Dr. Barry Eppley, plastic surgeon of Indianapolis, and I want to discuss with you the treatment of facial lipoatrophy with submalar cheek. Facial lipoatrophy is a not uncommon condition in where the buccal fat pad and other areas of subcutaneous fat are either congenitally missing or disappear over time. This can come from a variety of conditions, including one's own genetic makeup or in certain diseases and their subsequent treatments. This creates a relatively classic presentation, as you see here, with indentations beneath the prominence of the cheekbone, creating a very sunken-in or gaunt. If you look at this really subcheek deformity, there is tissue missing in the buccal fat pad area as well as below the prominence of the cheek. Therefore, its treatment needs to add volume to this area. The submalar cheek implant is relatively ideal for these patients. This is a not very well known type of cheek implant because it does not sit in the classic position on the prominence of the cheek, but rather sits more on the underside, adding volume to the upper buccal fat pad area where some of the tissue is lost. This implant is historically well known to be used in the early facial aging patient to create a little uplift of sagging cheek tissue in this area. Now, this implant is placed, like all cheek implants, through an incision up inside the mouth, and I always prefer to secure the implant to the position on the bone with a small screw. When the implant is placed in this area, it adds volume. This can be supplemented with fat injections throughout other areas that may be missing, but I believe the submalar cheek implant is really the cornerstone of trying to improve this appearance of facial atrophy. One can see here that it is a subtle but significant improvement that adds fullness and creates an overall not only more proportionate but a healthier look for the patient. This is a simple outpatient procedure that takes 1 hour of surgery to do, and definitely at least partially treats the cheek and side of the face areas where facial lipoatrophy exerts its greatest effects. I have used this commonly in a variety of patients and find it to be a very simple and satisfying procedure. Again, it may be necessary in some patients to supplement the areas with fat injections, as the submalar cheek implants will only go so far in terms of covering the defect. Fat injections may be needed above the lip area out into the sides of the face if the fat loss is more significant.